Just checking that everyone can see. Brilliant. Okay, so as the title says, so you're all here to hear about this new document. So today is just a very brief meeting where we can introduce it to you all. So it's key considerations to facilitate and sustain public and patient membership on institutional research ethics committees. Bit of a mouthful, but if you're on this call, you must have some sort of interest. So we'll get a little bit more into the detail of it as the meeting goes on. So I'm very pleased to be co-facilitating this meeting with Dr. Emma Doris from UCD, who's going to speak next. And we have Marina Cronin and Lynn Hertz, who are two members of this subgroup committee, who will also be speaking about the process of developing this guideline and the insights that they brought from their respective organisations. We will have time for questions as well. So after Emma finishes speaking, we'll have a little bit of time for questions, and then at the end as well. So please feel free to raise your hand, pop something in the chat, and yeah, if there's anything that we don't get time to deal with before we finish up at 12:45, then we will follow up by email with those of you that had any questions or comments afterwards. So Emma, if that's okay with you, I'm going to pass straight over to you. So I'll stop sharing my screen.
Thank you very much. I presume people will shout if they can't see it. So I'm just going to give a little bit of a background as to how this work came about. So my name, as you've mentioned, is Dr. Emma Doris. I'm the Programme Manager of the PPI Ignite Network, and UCD and RCSI co-lead Work Package 3. So I think most people here know who the PPI Ignite Network is. Apologies to my colleagues from Galway. Oh no, I did use the new University of Galway logo. I'm okay. So we are funded by the HRB and what is now tagged Éireann, Irish Research, and the 7 core universities also put in co-funding. So we are a network of people with shared interest working towards building a better environment for research that embeds public and patient involvement throughout. As part of the PPI Ignite network, we have 5 core national work packages. So each site also does local work packages, but we have a set of national work packages. Now, the work that we're showing you today arose from Work Package 3, which is called Embedding PPI Locally and Nationally. So what do we actually mean by that? What do we mean by embedding PPI locally and nationally? Really, it's about the sustainability of PPI particularly within our research institutions. So at an institutional rather than at a project level, how are we going about actually making PPI as part of the policies and practices that happen across the different research organizations? So it's really looking at the embedded nature of PPI so that we're not just carrying out PPI activities, but we're actually consolidating that into PPI practice as part of the norm. So this work package is led, as I mentioned, by UCD and RCSI. So UCD is Professor Thilo Kroll and myself, and RCSI is led by Professor Michelle Flood and Niamh. Although we lead the work package, we have a variety of people who are involved with the work that we do. So all the work that we do is generally formed by teams of people from throughout the network and beyond the network as well. We very much take a multi-stakeholder approach, knowing that there is different knowledge held in different parts of the network, and we really capitalize upon that. So what do we do? We in Work Package 3, as I mentioned, we look at the institutional aspect. So we look across the different PPI Ignite sites, how embedded is PPI actually in each of those institutions, and then how can we learn from each of those institutions? So that's a flavor of some of the things that we've done in the past. But right from the development of the PPI network, written into our grant was to specifically look at the area of research ethics. Research ethics and the ethical practice of research was identified as being a core activity that needed specialized attention when it came to embedding public and patient involvement within a particular function of the university. So the quote that I have written up there is direct from that grant that was written back a number of years ago. But research ethics committees on an institutional level it's a very broad thing, and we can't possibly tackle everything that there is to do around public and patient involvement and research ethics in an institution. So how did we decide what actually our core priorities were? So we had a multi-stakeholder group from across the network, and we discussed what the key issues were in relation to PPI research ethics, specifically from an institutional lens. So yes, people with a experience on a project level or personal experience were involved with this, but we were really looking not at an individual's, I suppose, challenges, but at the institutional level challenges. So we formed a consensus on the top issues to focus on, and then we developed short life working groups for each of these issues. So the subgroup 1 was formed in 2023, and it looked at whether prior research ethics approval was required for PPI activities. One of the questions we frequently get from researchers was, before I engage with people with lived experience, do I actually need research ethics committee approval for that? So there was a lot of confusion around this, and it's part of that confusion around participant versus PPI contributor, which thankfully we're far more at advanced stage now than we were when we started looking at this. But our goal was to provide clarification for research ethics committees and the institutions themselves, and also for researchers and PPI contributors. So we worked with a group of PPI specialists, ethics project officers from different institutions, PPI contributors and researchers themselves. And by looking through the literature and also doing our own work, we prepared a draft statement. We then had a consultation via a survey, and we finalized the statement. So the statement that we did from the first working group focused on ethics was that approval from a research ethics committee is not required for public and patient involvement in the idea generation, planning, and interpretation of findings or dissemination stages of research. And that is because contributors are not research participants or data providers. So that came out of that first work package, and that and all of the work that we do at the national level is available on the national PPI website, PPI Ignite Network/resources. So the subgroup 2, which was the next area to tackle, was focusing on the operational aspects of embedding PPI in institutional research ethics committees. And this is the work that we're talking about predominantly today, led by Niamh. And it was very much clear that it wasn't sufficient just to have somebody involved on a committee. There were institutional aspects that would need to be amended or changed to allow that to happen in a mutually beneficial and equitable process. And we need to identify what they were so that people could put aspects in place to enable that to happen. So that's what Niamh and Marina and Lynn are going to be talking about for the rest of this webinar, but I just wanted to give you a little bit of a flavour of the background of some of the other work that we do. So if there are any questions, I will stop sharing now. Thanks very much. So if there are no questions at this stage, which is absolutely fine, I'll pass back over to Niamh.
Brilliant. Thanks so much, Emma. It was a really thorough and clear, I think, description of how we got to the place that we are now for this guideline. So I will just share my screen again. It's just to give you a little bit of a background as to how the document came about. And then after that, we'll pass over to Marina and Lynn to tell you a little bit about the subgroup. So if I just share my... Okay, you see my full screen there? Brilliant. So I guess just as Emma mentioned, we were focused mainly on identifying the operational challenges that come with expanding membership for research ethics committees to patients, people in the general public, so that they can meaningfully get involved with the with the committees. We had 12 members, so representatives from 2 of the lead sites, from RCSI and from UCD. We had 3 national partner organisations, 1 publicly funded organisation, research ethics officer, and we had 2 PPI contributors as well. So between all of us, there was a lot of experience, both current and previous, on REC membership and on governance boards in general, because there was a lot of, I guess, cross-pollination of ideas, and not just from an ethics perspective, but in general about supporting people that are new to a different way of working on a committee, and making sure that, you know, the challenges can be foreseen so that they can properly get embedded. We had our first meeting on the 17th of April. We had 4 meetings between then and the 4th of July. And after that, most of the activities took place online. It was bouncing back and forth ideas, sharing more resources, speaking to other members in between the meetings, and then drafting the guideline itself. So I should say a huge thanks to all of the people that we spoke to outside of these meetings and outside of the subgroup. So we spoke to many members of the HSE reference recs, of NREC, of TUSLA and other institutional recs as well, who gave their insights and their just generally their time to talk about what how their committees run, giving us more insight at a granular level of how things are done, you know, what the workload is like, how often they meet, how they interact with members, what training they have. People were very generous with their time, and I think there was a real appetite to try and share that learning that people have. We also spoke to some members from other countries, so from the UK in particular. 2 members were very generous with giving us details about how their institutional recs have incorporated PPI members over time. So at our meetings, I guess just to set the landscape and help us with our discussions, there were many kind of pivotal resources that we used at the beginning to kind of set the scene and make sure that we were on the right track to get the conversation started. I have some of them just here on the screen, and I can share details of them as well in the chat, just if anyone is interested. They're publicly available. The patient engagement open forum, Let's Talk Ethics, there's also a webinar of that meeting, so if anyone is interested in watching that, it's really useful as well. And I guess just now, just to say that to show you just the structure of the guideline, so we kind of categorized it into 4 steps. The first being contemplation, moving on to preparation, action, and maintenance. So we recognize that there's a lot of committees that are probably at the point of thinking that this is a really good opportunity to expand their membership, and they might want to get started with introducing PPI members. But what we want at that stage is to make sure that they recognize you know, first of all, the rationale for introducing people. There might be other members of the committee that don't see as much of a need to change how they work. So I think the contemplation stage is really an opportunity for committees on a whole to agree together to put forward, I guess, this idea that's going to really improve the way that they can work, hopefully, but also just making sure that it's done in a logical step. Preparation. So this is where we really drew on the experience of the committee members. So they were able to give a lot of background as to how to review existing structures that are in place, and then what steps might need to be taken at each institution, because everywhere is so different. And it became very clear very quickly that there needs to be a lot of interdepartment working. So you have to make sure that you're speaking to people from the IT department, from HR, from many other places, just to make sure that any of these barriers can be identified and then steps can be taken to remove them. And maintenance is important as well. So if a committee is putting all this work into expanding their membership for PPI contributors, we want to make sure that it is a good use of everyone's time, that it's rewarding for the members that are joining the committee, that they feel valued, and that the committee as a whole feel like everything is working well. So we have put in some points in terms of making sure that they continue to evaluate the process. Again, really drawing on the expertise of our subgroup committee members. So the document itself is really it's kind of question prompts. So it's intended for committee members to take and to use and apply for their own perspectives and for how they work. It's not expected to be an absolute list or a protocol for how research ethics committees will run, but more it's just a springboard to get these conversations started and to really hopefully progress things to make a more inclusive committee with PPI contributors. So I'm going to introduce Marina Cronin first. So we're delighted to have Marina on the committee with us. Marina has joined us from the National Office of Clinical Audit. And I think, Marina, you have some slides that you'd like to share. So I'm going to stop sharing so you can share your screen.
Sure. Thank you very much, Niamh. How's that?
Perfect.
Great. Thank you very, very much. Okay, listen, thank you to Emma and Niamh for inviting me today. Obviously, my name is Marina Cronin. I'm from the National Office of Clinical Audit. So I am not here I don't have huge experience of research ethics committees, but we do have a lot of experience of public and patient involvement at NOCA. And I guess that was what we were bringing to the committee. Just to give you a sense of who NOCA is, and I won't spend too long on this, but we are an audit organisation. We're actually commissioned and funded by the HSE, but we're operationally sit in the RCFI, and we work to a governance board. Our mission is to provide good information to inform the health service how it works, and health service professionals, but also to inform the public how it works. And I tell you this because it gives you a sense of why public and patient involvement is so important to us, especially that second part about informing the public about how their health service is performing. We have the largest portfolio of national clinical audits. We currently manage and govern 11 clinical audits, and we have 4 projects in development. So how do we include public and patient interest representatives across these projects? So each individual audit has a governance committee, and that governance committee includes health professionals across all the stakeholder interest groups. So if you consider that as something similar to your research ethics committee, but each of those governance committees as well seeks to include at least 2 patient and public interest representatives on that committee, and that is where our patient and public interest representatives come into NOCA. So the role of that governance committee is to oversee the development of an audit project and its implementation and any outputs coming from it. So our patient and public interest representatives are working alongside, partnering alongside all the other members of that committee to oversee that audit. At NOCA as well, for the last 2 years, Bridget Doherty has led public and patient involvement from the board perspective. Bridget has many years' experience in healthcare advocacy. Just to go back to our governance committee, who do we seek to involve there? We try and involve people with experience, so people who have had experience of the topic we're auditing, but also a representative coming from an advocacy organisation. So this brings a broader experience and a greater skill set to those governance committees. And I'm just going to go to the next slide for 2 moments, just to get in terms of the advocacy organisations. That will give you a sense of some of the advocacy organisations that are sitting across some of our governance committees. Going from Arthritis Ireland on one side to representing patients, who have orthopaedic conditions, to the Strange Boat organisation representing families of organ donation. So that gives you a sense as well of the advocacy organisations and also where people from experience are coming. I'll just go back up to here for a moment. How do we work with our patient public interest representatives? So when a patient or public interest representatives join one of our committees, we firstly orientate or onboard them, and we have a kind of a series of steps which we follow. This is mainly led by the project or audit manager with support from an audit clinical lead, but also in terms of joining that committee, the chair of that committee has a really important role in involving those patient and public interest representatives in the conversations that are happening at meetings. And I suppose I share that with you because I think this is an important part in terms of I think the maintaining role that's outlined in the document. But also, I think, we can kind of very much align to the role of the chair of the Research Ethics Committee. And chairs have such important roles. I want to say as well, all of our public and patient interest reps at the moment are volunteering. We do not have a budget at the moment to to compensate them for their time, but we do cover travel expenses and so on. That is where we are at the moment. I do believe that will change in the next few years. So I share all that with you because I guess what I wanted to give you a sense of where we are, where we started, where we are now, and is an entirely different place. And I expect we'll be in a different place again in 5 years' time. So just as well to give you a sense of the value that patient and public interest reps have brought to our audit. And I've mentioned already, they're at that decision-making table overseeing the audit. But it's really important in the outputs from our audit. And if I take you back to where I started, one of the missions of our national clinical audit is to inform the public and the healthcare professionals how their health service is performing. So these are some of the outputs. The next slide shows you some of the outputs from that patient public involvement. And this is from 2024. We had patient stories across our national audit reports. And this obviously brings insight and experience to the data we present. And that's hugely, hugely important. Our patient and public interest representative, we also produce summary reports as part of the report package coming from the National Clinical Audit. There is a detailed report and a summary report. The summary report is a very visual document to reach the public more generally. And our patient public interest representatives on our committees share their insights, and you can see some of them there in those summary reports. So that's their voice coming through really, really strong. So you can see the value and impact that patient and public interest representatives are having on our reports. And then finally, in the new space we're moving into, sense checking some public health messaging coming from our reports. And these are some of the public health messaging coming from our national reports in 2024. Obviously, I want to acknowledge some of our NOCA patient public interest representatives that work with us across all of our governance committees, and you can see them here on this table. And I guess, I suppose my reflections are, we have worked through all of the steps outlined in the current document in our own way over the past 10 years. I really welcome this document. I think it gives you a sense of a journey. But every research ethics committee, I think, as both Niamh and Emma have said, will be in a different spaces at a different time. The important thing is to start this journey and to move forward. Then congratulations on the document, and thank you very much for the invite. And I will stop sharing now.
That's brilliant. Thank you so much, Marina. I think that gives a really good overview of the real huge amount of work that NOCA have done in embedding PPI into your structures. And I think that's why it was particularly useful for you to be on our subcommittee, especially when you mentioned there about the how you oriented and onboarded new members and the steps that were taken. That real kind of structure to it is so useful to hear about. Next, I'm going to go to Lynn Hertz from TUSLA, Child and Family Agency. So Lynn was also a member of our subgroup. I'm delighted that she's here with us. And in many ways, I guess the TUSLA Independent Research Ethics Committee was our gold standard model, really, in terms of them being through 2 phases of it now. So Lynn, you're very welcome. And could you just give us maybe a bit of background, please, on you and TUSLA as an agency?
Certainly. Thank you, Niamh, and thank you, Em, for the chance to be here today and to speak to people about the Research Ethics Committee. So in TUSLA, it's an independent research ethics committee with the operational support of the TUSLA National Research Office. The independent committee was established in 2021 and to have a 3-year term. So last year we went back out again and we had some people to remain on. Some people left after their 3 years and we recruited again. But I suppose our look at the importance of public members. So TUSLA was never going to be tokenistic. It was never going to have one public member and the rest were going to be staff or various professional external people. So it was a very conscious decision. Our 15-member committee is made up of 5 TUSLA staff, 5 external members, those with academic backgrounds or, they have carried out research or they've applied for their own ethics. And then we have 5 public members. They may have no experience of research, but they are an expert by experience, whether that be mental health experience, whether that be as in receipt of TUSLA services in the past or maybe currently, whether they be a foster carer. So it's just their knowledge and their interest. And as I say, it's evenly, it's 5 and 5 and 5. So everybody is looked upon as being the same. And I suppose at the start of the committee, an induction training was given. And I suppose it was very important that we brought to this group the importance that everybody is treated the same, regardless of your background, regardless of what your title is. If you're a committee member, you're a committee member and you are all the same. So our induction training was given to every member of the committee, the very same training. And when it comes to training as well, ongoing training is always there. If there's something identified within the committee, we can provide some training, again, with the support of the National Research Office and our colleagues there. And one of the last things I suppose I would say as well, which we thought of at the very beginning, was not to forget that a distress protocol should be in place for your public members on committees, well, for all members, but particularly your public members. If they're reviewing ethical applications, something might trigger them. You don't know everybody's background. You don't need to know the ins and outs of everybody's background, but you just need to know that you have something there that you're able to support people, regardless of where they're coming from. You need to be able to provide them with that. And one other thing I suppose I found very interesting from discussing and working on the paper with Niamh and the other people in the group, we came up against things we were talking about, making sure everything is accessible for everybody. And then the more we delved into that, it was not just a case of holding a meeting in a building that's accessible for everybody, but making sure everybody has access to a laptop. And does everybody have access to the correct software on the laptop if it's needed? So making sure that nobody's kind of being put out of pocket, but looking to see that accessibility is right across, not just, entering a building, but having the tools and having the materials for public members to feel that they can carry out the same job as a staff member. So if anybody has any questions or anything, if you want to put them into the chat, or I'd be happy to try and answer some for you now. Thank you again, Niamh.
Thank you so much, Lynn. That's really useful to hear. And yeah, I think a point that you mentioned about the distress protocol, hugely valuable. And these are all things that we would strongly advise and encourage research ethics committees to consider and have in place, just to make things more straightforward along the way. I actually have a question, I guess, for both of you, if I may start, if that's okay. I guess both of your experiences are hugely valuable and very unique, I guess, in that they differ from maybe the university institutional research ethics committees. So I wanted to just ask you both, what was it like meeting with other members of the subgroup who would be bringing their different experiences of being on university recs? I'm thinking of our rec administrator who her insights were brilliant in terms of the logistical challenges that come with a committee that obviously has a huge workload, and also the PPI contributors that were on the committee. What did you both gain, I guess, from working with people from those different backgrounds?
I might go first then. I actually found it very insightful to get a better understanding of how research ethics committees work, because that's not my area of experience. But we faced very similar challenges. Meeting time, logistics of meetings. That's something we too face. I guess I guess we differed in terms of our agendas are not as varied. If you're on an audit committee which looks at heart attack audit, it will always be on that topic. So I'm appreciating the challenges of if you're looking at different applications and different topics. We did consider throughout the years of establishing a distress protocol, but actually we didn't go into that place because our engagement was much more. I'm trying to think of the word. I'm going to say it remained more stable because our engagement, with our patient representatives, because we're the same patient representatives on the same committee. What I didn't share with you either was like we meet within NOCA, we meet those patient representatives every 6 to 8 weeks on an informal coffee, and that's where we say to them, please share if if there's anything you want to talk to us about, anything you need to share to see how to navigate or whatever. That's an informal coffee catch up, and it really is informal. And I think that probably may maybe kind of be an opening for that kind of thing. I found it insightful as well. In terms of working with patient representatives on our committees, I think that's something we've a lot of experience of, and it's something we've really, really valued within NOCA. And I think what's been really important to us, it's been valued, I think at our most senior level, but also by all of our audit managers. And maybe that's the place we're in now after many years of it. And I think that's a place that every research ethics committee will get to. As you tread your toes. I said earlier, I think it's a journey, and it doesn't all happen at once. And sometimes it's a little scary, kind of sharing your experiences in that place. So it's and the other thing is a really good chair. I think we need to prepare our chairs as well for all committee members, but so that they're supporting every committee member in to achieve whatever your meeting purpose is. Yeah, thank you.
Thank you, Marina. That's brilliant. Lynn, I might come back to you.
Yep, thank you, Niamh. I suppose one of the things that I found really interesting. And one of the conversations we had during one of our meetings was in relation to a remuneration or a payment. And it was a case of, do you pay everybody? Do we pay public members? Do we not pay external professional people? And I suppose for us in the background, like our colleagues in our National Research Office had been working on this for quite a long time. And it was about trying to find, you're trying to find the right guidelines and the right legislation to go by, and you're introducing something new that could, it could cost any agency quite a bit, so that had to be looked at as well. Now, we did have travel and subsistence rates, but to actually be able to give them payment for their time that they're giving, I suppose that was that was a bit of an eye opener for us. And now, when our meetings were ongoing last year, this was going on in the background. My colleagues were developing guidance for this. And I suppose now I can share with you that that guidance did get approved. So Tuesday, I'm very, very lucky to be in a position to say we do have a guidance on remuneration for public members of committees. Yeah.
That's fantastic to hear, Lynn. And yeah, I guess to echo what you said, that's something I think that we ended up talking about a lot, wasn't it? Remuneration among the members, and concerns, I think, from individual institutions, of just because everyone has different structures and different ways of managing their research ethics committees. So it's making sure that there are resources, I guess, set aside for something that is, their time should be really valued. Their membership is not the same as, say, the professional or academic members that are on the committee. But it certainly was something that, there's a lot of, I guess, nuance to how these committees work. So it's something that we considered at each individual institution. I might open the floor and see if anyone has any questions. I see one in the chat there from John. How do you get onto a REC as a PPI member? I guess now people can hop in here a couple of places. So individually, universities might be making calls, so expressions of interest to members of the public that might be interested. Recently, there was an opportunity on the PPI Ignite Network opportunities notice board. So I might put a link to that in the chat. So I guess that might be one place to keep an eye out for if opportunities like this arise. And also I do see there's some, thanks Edel for getting in there so quickly. Also there's some people on the call that were part of the development committee, and I think students as well of the IPOSI and HSC research and development ethics module. So that was a great opportunity for members of the public with an interest in research ethics committees and in ethics in general to hear more about how committees like this run. And off the back of that, I think it's likely that there might be opportunities to get involved. Thank you. Mary Claire O'Hara has just put a link there as well for HSE reference recs, which is a great link to have. So I think if anyone has any other comments on that in terms of places to look for opportunities at individual universities.
I think you've largely covered it, Niamh. I mean, NREC, the National Research Ethics Committee, will put out a public call, and there's a formal process for that. But for other institutions, it's often on an institution by institution basis. But one definitely keeping an eye on the PPI Ignite Opportunities Notice Board is certainly would be the way that I'd recommend if you're looking more locally for a more local institution.
Sorry, I can't find my hand. I'm from NREC. I work in NREC, and we have it's a rolling membership. So if anyone's interested, it's on our website. I can put the website up here, but it's a rolling sort of call for expressions of interest. So we're always welcome. We're always looking for new members, especially PPI members.
That's fantastic. Thanks for putting on to let us know. And actually, speaking of links in the chat, I will just put a quick link to the document itself. So if anyone hasn't seen it yet, it is available on the PPI Ignite Network website. And that's the direct link to it. And I should say that this is version 1. So what we'd love for everyone on the call is to take this document, share it with anyone in your organisation that you think it might be of interest to. We do have a small number of hard copies as well, so if anyone's interested in us specifically reaching out to someone with a copy, feel free to get in touch with me. And I guess, yeah, specifically for anyone that's on research ethics committees, if you think they would be interested in seeing this document, it is version 1. So what we would hope is that there are you know, adjustments that we can make over time when we hear back on individual research ethics committees' experiences of having PPI members on them. There are many that already do, but there's a lot more that are probably in the process of setting this up. So over time, we would look to review the information in this and hopefully expand on it, make it a bit more relevant if things arise in the future. Thanks, Emma. Yes, we'll share the links via email to everyone who's registered. We'll also be sharing a feedback form. So if you do have a minute or two to fill that out, we'd really appreciate it. Anything else? I guess actually just before we finish, I would just like to give a huge thanks again to everyone that was involved in the subgroup and in the overall working for Work Package 3. So in particular to Thilo Kroll, Emma Doris, Michelle Flood, Edel Tierney, Lynn Hertz from TUSLA, Noreen Lacey from Maynooth, Deirdre Clayton from Maynooth, Jan Stokes from UCD, Melissa Crudden from Queen's, Marina Cronin from NOCA, our PPI contributors Mandy Daly and Cameron Kieran, and to everyone else who took the time to have conversations, casual, informal conversations over coffee, Teams meetings to gather all this information. It was really, really helpful. And thanks again, I guess, to the PPI Ignite Network funded by HRB and Research Ireland as well for allowing this to happen. So I'm going to stop the recording. Feel free if there's any other questions or comments to get in touch with us afterwards. Again, as Emma mentioned, I'll share the links and everything with attendees.
And a final thank you to Niamh for